important advice to patients going for home BP monitoring, and it is applicable to clinic BP monitoring as well. So avoid smoking, eating, drinking coffee, and exercise 30 minutes. So these things they are not doing normally, but sometimes I've seen with this clinic where I'm sitting, the patient come running and the nurses just pull them to get the blood pressure check. And obviously we see the blood pressure is high. So ask them to sit at least for 5-10 minutes before they do the blood pressure. Ask them to do the other things first, and then they check the blood pressure. Same thing when you or the patient enter your room, even if you know that you have to check the blood pressure, first engage the patient with normal chit chat and do something else, and then relax the patient and then do the blood pressure checking. Ensure quiet environment. Nowadays, mobile particularly, there's a lot of distraction. So even in the clinic, the mobile rings and the patient got anxious, or doctor may be angry if the mobile rings, and definitely that affects their blood pressure. How to sit? No, yes. When we check the blood pressure, oh, Mr. Singh, you're there for this BP check or whatever. And we keep on, what happened to your little daughter? How well she is, which class she is on. And we keep on talking, engage them, or even we continue with our questioning about their health issues, that how bad is your breathing problem, whether there is any leg swelling, etc., etc. So they have to sit quiet with arm outstretched, and all these points you have learned in the medical school, but we hardly follow. Have you seen whether their legs are crossed or not? Where you are putting the BP, I have seen the nurses, they're putting the BP on the sweater. They said they can't open the sweater. So that is why it's a cardigan or thick shirts, particularly with men, and nowadays women wearing nice dresses, they can't take it off and they are putting that on the dresses, and that will definitely give a wrong result. And also the cuff size which you are using, that is also important. So legs would be uncrossed, the feet on the ground, you should be relaxed and not talking, and that's how it should be measured. Now, when you are diagnosing this with home BP monitoring, definitely the patient will ask that how frequently I have to do it. They sometimes are interested to take the ownership of their own health, and these are good patients. So if you ask them to do it for the diagnosis, I'm just impressing on this word for the diagnosis, because this is not applicable for monitoring blood pressure. So for the diagnosis, they have to do it for 7 days, minimum for 4 days, morning and evening. Morning means 6 a.m. to 12 noon and 6 p.m. to 12 midnight, any time between that, 1 minute apart, 2 readings, and take the average, and then just note it down, and you will get 14 records. So discard the fast days record and take the average of from day 2 to day 7. And that is how you can get the average of home BP monitoring. So ignore the reading from the first day that I have, because that causes a lot of anxiety. How am I doing? Whether it is right or wrong. Gradually, the patient gets confidence.